This was not just a, oops, we made a minor mistake that didn't harm any patients.
Any other laboratory would have been shut down.
Lab experts speaking out tonight, shocked that the state allowed its billion-dollar COVID lab to continue operating for nearly a year while putting public health at risk. This after the state finally released its investigation prompted by our whistleblower investigation.
As CBS 13 investigative reporter Julie Watts shows us, inspectors did confirm the whistleblower allegations, but you wouldn't know based on the state's public report.
Yeah, guys, in its public summary, the state claimed inspectors found problems that are, quote, routinely found in lab inspections and that had, quote, no impact on the integrity of tests processed at the laboratory. But buried way down at the bottom was a link to the actual records, which lab experts say contradict those claims.
Are these deficiencies that are routinely found?
Never to that magnitude.
I've never inspected a lab that had this many problems. That's like Lab 101.
Tim Hamill is the former chair of the state's Clinical Lab Advisory Committee. Dora Gatto is a current member and represents the state's Lab Tech Association.
Any other laboratory would have been shut down.
And until the lab is ready to turn out a consistently quality test, they shouldn't have started.
They're among many in the licensed laboratory community, shocked that the state's COVID lab was allowed to continue processing patient samples while failing to correct deficiencies for nearly a year without revealing the risk to patients.
Not how laboratories are supposed to operate in the United States.
In February, inspectors found roughly half the lab staff did not have documented competency or training.
The staff are very untrained and unsupervised,
confirming whistleblower allegations that the state initially denied. Inspectors also confirmed the lab reported wrong results but waited to notify patients.
Why would it take so long? It's tragic.
Inspectors confirmed contamination concerns and that the lab was effectively hiding lab accidents or errors. But maybe most concerning, inspectors confirmed the lab made changes to the FDA-authorized test but didn't validate them for accuracy while claiming they did to patients.
If a test is not validated, it's considered experimental. The patient should be aware and needs to agree.
But the state never warned the public or paused testing as the lab struggled with their validation for months, even facing sanctions for it in October, just days before the $1.7 billion contract was renewed.
And that was appalling.
In two separate reports, inspectors found the lab posed immediate jeopardy to patient health and safety, likely to cause serious injury, harm, or death. Still, CDPH's summary claimed there was no impact to the integrity of the tests processed at the laboratory.
That would be impossible. You just can't make a statement like that. It makes no sense.
This was not just a, oops, we made a minor mistake that didn't harm any patients.
Inspectors even chastised the lab director in this letter for downplaying the risk, noting there is no acceptable error rate for false negative results for a highly transmissible viral infection.
Do you agree with their assessment?
We asked state inspectors today at a public meeting about the discrepancy between their findings and the state's public report.
I will stand behind my team's report.
But the chief of the inspectors said he couldn't comment on what the state's communications team wrote. Now, CDPH wouldn't tell us who wrote their summary, and they've yet to provide a single example of any other lab with this many deficiencies that was allowed to continue processing patient samples while failing to correct those deficiencies, which in this case, according to inspectors, took nearly a year.